So the GI disorders, and so far we've discussed and talked about two particular disorders in the digestive system. Number one being ulcers or peptic ulcers, to be specific. And then secondly, we discussed constipation. And so today we want to discuss or look at some symptoms of the GI tract and how we can wholly eradicate or do away with these particular symptoms. An example of a digestive disorder, a symptom for digestive disorders is heartburn. We want to look at heartburn and how we can go about it using natural remedies. We want to look at some other thing is halitosis or bad breath. We want to look into that and various signs and symptoms that are associated with digestive disorders. So when the digestive system is unhealthy, as we said, there are a lot of diseases that can arise from that. An example is piles or hemorrhoids. You can be constipated. You can have diagnosis. You can have parasites in your digestive system. You can have Crohn's disease, appendicitis. You can have gastric ulcers, esophageal ulcers, duodenal ulcers, pancreatitis. You can have gallstones. You can have hepatitis, a bacterial or viral. You can have liver cirrhosis. Depending on how good you treat your digestive system, depending on how, not really how good, but depending on how you treat your digestive system, you can either end up having these particular disorders or probably not have them. And so we've talked about several of them, and we've seen that the digestive tract is a long muscular tube that moves food and accumulated secretions from the mouth to the anus. That's the anal region. And the GI tract includes all structures between the mouth, that particular tubing between the mouth and the anal region. And the tract itself is divided into upper and lower, the lower tract. And so the upper gastrointestinal system or the upper digestive system, this is where we have the mouth, the esophagus, the stomach, and finally the duodenum. The duodenum is part of the small intestine. The small intestine is grouped into three. We have the duodenum, jejunum, and the ileum. So for the lower gastrointestinal tract, we have other parts of the small intestines and the whole large intestine. The large intestine as well is divided or segregated into three. That is ascending, descending, transverse, colon. Actually, there are four. So, so the exact demarcation between the upper and the lower tract is the suspensory ligament of the duodenum, also known ligament of traits, which is not really common, which is really not that significant to us as medical missionaries clinically. So these are parts or some of the disorders, the symptoms, and the signs that are related to the GI system. So heartburn is a sign or a symptom. Stomach inflammation or gastritis, we talked about ulcers, which is part of stomach inflammation. We have gallstones, which we'll study and look deeply into and how we can go about them. We have chronic and acute diarrhea. We have dysentery, Crohn's disease, which we'll know and learn. We have celiac disease, which is an autoimmune response. It's actually an allergy towards gluten. We have lactose intolerance, also an allergy towards this particular sugar in milk called lactose. We have kwashiorkor, which is protein deficiency. Probably protein is not being metabolized well and properly in your stomach, or you're just deficient, you're not taking enough protein. So those are some of the GI disorders that we'll look into today. We looked at constipation and everything about constipation. So allow me, just give me a minute to take the roll call of the members who are currently present. Let me take the roll call of the present members before we proceed. Anyone who knows what dysentery is? I hope my voice is clear. Anyone who knows what dysentery is? What is dysentery? Someone who has a clue? Someone who has a clue can help us out. Dysentery. I believe that most of us know what diarrhea is. Anyone who knows what dysentery is? Okay. Dysentery. The simplest way I can put it is graduated diarrhea that has graduated, or chronic diarrhea. It normally comes with some bloody stool. Diarrhea and dysentery, they're normally bacterial infections, and the best herbs to use for such, if it's diarrhea, you'll want to use probably activated charcoal. If someone is diarrheaing, probably you'd want to use activated charcoal. That's the best that I've used in my experience. That will help harden the stool and do away with the diarrhea in about 3 days. And then aside from that, you'll have, or you should use some herbs that will help kill the bacteria that are causing that particular diarrhea. And an example, probably this is where you'll write, an example is a Ajuga remota is a very, very, very powerful herb, a very powerful antibacterial for gastrointestinal disorders, Ajuga remota. Some other herb is Artemisia annua or wormwood. Just write wormwood or Artemisia annua. Let me write them for us in the chat box. So for charcoal, you can use 2 tablespoons diluted in warm water morning and evening, or you can use charcoal capsules, 5 capsules in the morning, 5 capsules in the evening. That's when you are using them. If they're capsulated, if they're tablets, probably 3 tablets are enough. Morning, 3 tablets in the evening. That will help with your diarrhea. And then you'll need some wormwood to help do away or kill the bacteria. So what are some of the symptoms of these particular disorders? As I said, diarrhea and dysentery, they're more or less the same thing. Dysentery is a little bit worse, or graduated diarrhea. So what are some of the symptoms? Frequent and loose watery bowel movement. This is often accompanied by cramping, abdominal pain, cramping It's more of the muscles of your abdomen moving or constricting. Abdominal pain, thirst, sudden need to eliminate, that is go to the toilet, visit the toilet. We have vomiting and possible fever at times. If you have an infection, obviously you'll have a fever. You'll obviously have a fever, or your temperature will be elevated, because that is one of the body's natural response towards boosting your immunity and killing that particular infection or bacteria that is causing your fever, even if it's a virus. So the causes of severe diarrhea can produce loss of essential electrolytes. Electrolytes are things like sodium. And so, when you diarrhea, you lose a lot of water. And when you lose a lot of water, a lot of sodium is flushed from your system. And this interferes with the integrity of water absorption in the colon. And so that normal balance of electrolyte is very, very essential for good health. So there are minerals like potassium and sodium that helps with that normal balance. But we'll look at this particular balance, the electrolyte balance in the system. Actually, also vomiting a lot would lead to that, and result in pallor, listlessness, and dark circles under the eye to a greater extent when it becomes worse. So, what are some of the causes? Overeating, food poisoning, stress, incomplete digestion of food, and there are certain drugs that could at times cause it. We have bacteria, that's the flus. Intestinal parasites would as well cause it. Caffeine, contaminated water, infection, whatever type of infection. H. pylori as well can cause diarrhea. Eating soap, ingesting certain chemicals, and some diseases like inflammatory bowel disease, lactose intolerance from milk can cause someone to diarrhea, and some food allergies can cause someone to diarrhea. And so in Ministry of Healing, page 127, in Ministry of Healing, page 127, okay, my book is not here. It's not close to me, but page 127, when you read paragraph 2, we'll study this. We'll study this and we'll still look at it. At now, allow me just to mention it in passing. So in page 127, the second paragraph, God counsels us that in case of any disease, we ought to first of all ascertain the cause. And once you ascertain the cause, it will be very, very easy for you to actually manage and treat it. Because if you have a patient who is diarrheaing and you know that the cause probably is the food allergies, you'll take them off those particular food substances that are causing the allergies. And from that, you shall have done them a lot of good in managing and treating their condition. And so knowing the causes is very, very important. That's why we study anatomy. That's why we study physiology and we study diseases. So once you know and ascertain the causes, you can easily administer medication. So an example is diarrhea. You can probably be administering a drug, aloe vera, to someone who has diarrhea, and probably they're not responding. They're not responding. Why? Because probably to them, cases are at times different. Probably to them, they are lactose intolerant. And in your treatment, you are giving them something to help combat their disorder, but then they're still using and taking that which is causing that particular disorder that you are addressing. And so it will be very difficult to wholly eradicate the disorder, because the cause has not been removed. And so the wisest thing when dealing with any disease is to remove the cause. So those are some of the causes of diarrhea. So when using the remedies that I've talked about, that is activated charcoal, a juggery mortar, wormwood, fenugreek, fennel, you can easily, if you know it, H. pylori, you'll give them aloe vera or probably wormwood, and they'll become well. They'll become well. So we'll know how to use these particular herbs that currently I'm just mentioning in passing. We'll know how to use them for these specific diseases. So don't really worry. You can just list the herbs under every disease, but we'll know how to use them. So treatment, we have garlic is helpful in helping purify the gastrointestinal system. Garlic is a broad spectrum anti-antibiotic. Garlic kills H. pylori and other viral. Garlic is antiviral. It's antibacterial. So if the diarrhea is caused by a virus or a bacteria, it will help to do away with it. So carob powder. I believe most of us know carob. I have carob actually here with me. Carob powder is high in protein and helps stop diarrhea. Carob powder, it's very powerful. It's one of the therapies used in. You can use it as one of the one of the drugs in treating high blood pressure, because it helps. It helps lower blood cholesterol levels. The same thing to garlic. Garlic would also do that, lower or reduce the cholesterol levels in the blood, burn the plagues in the arteries and all that. So keep liquid consumption high, because you are losing a lot of liquid and you ought to replace it. A solution of clean water, sugar, and some salt intake. Why? Because when you lose a lot of liquid through diarrhea or dysentery, when you lose a lot of liquid, what happens? You are flushing out minerals from your body. So you need to remineralize. By taking some warm, clean water with some salt, Himalayan salt added to it or black salt added to it. Drink plenty of liquids, including water, broths, and juices. I believe we know what broths are. If you don't, we'll learn and know. Broths are from vegetables. Cooking several vegetables together in water and keeping that water, that particular water. Most of us probably refer to it as soup, but broths and soups are a different thing. So these are some of the helpful herbs that you can use alongside the ones that I mentioned earlier. White oak bark, blackberry. Blackberry is not that common in Kenya. Probably in the United States it's common. Clove root, a very bitter herb. Clove is a very bitter herb, and it's a very powerful antibiotic, anti-inflammatory. We have burdock root, we have echinacea. Echinacea is very powerful when it comes to boosting immunity and fighting bacteria and viruses. Echinacea, if you have respiratory disorders, this is one of the herbs that you need to go for. Echinacea, when you have respiratory diseases like bronchitis, asthma, probably flus, colds, influenza. This is the medication. This is the herb to go for. Echinacea and golden seal. They're very powerful for respiratory disorders. Golden seal is very, very good for allergies as well. So these are some of the helpful herbs. You can use. So generally, when using herbs, we'll talk about that. But generally, when using herbs, you should use herbs frequently, between 3 to 4 times in a day. You should use them frequently so that they can be effective 3 to 4 times in a day. And in preparations, there is normally a common, there's no one fit size rule, but there is normally a common ground that most botanical herbal doctors normally subscribe to. That is taking 2 to 3 tablespoons. That's the big spoon. Taking 2 to 3 tablespoons and steeping it in very hot water. Steeping it in very hot water until the water becomes warm. There are those herbs that you should sieve, and there are those that you really don't need to sieve. But we learn all that, the herbs that you should sieve and the ones that you should not sieve. But there are those herbs that you just dilute in warm water. You don't have to steep or to boil them. You just dilute. Those are extracts. You just dilute them in warm or hot water and drink. So for this case, you can take 2 tablespoons of one of these particular herbs, 1 or 2 of these particular herbs, steep them in 1 liter of very hot water. Close the pot with a lid, wait for it to become warm. Once it's warm, you can drink that 1 liter 2 times in a day. So if you are to take it 3 or 4 times, you need to make twice that amount. But we'll study more on how to make and prepare herbs. At this particular point, just know the herbs that you can use for different disorders. Is there any concern up to that point? Yes, Asanet.
I'm asking, can you mix drugs with herbs? Drugs or the ones that are in the hospitals, can we mix with the herbs?
Yes. There are herbs that you can mix with drugs, and there are herbs that you cannot mix with drugs. So when we'll be studying natural medicine, we'll study these herbs one by one, their properties, their chemical constituents, their indications, like which disorders are they supposed to be used for, their contraindications if someone has a particular disorder. Contraindication are situations or occasions in which a herb should not be used. So we'll study all that when talking about there's a unit that will cover that, but there are herbs that you can use with other drugs. An example is artemisia. Artemisia can be used, that is wormwood. Wormwood can be used with any medication. It won't counter-react, or it won't do anything bad. Let me just say it that way. There are herbs like activated charcoal that you shouldn't use with other hospital drugs. But we'll see more. We'll study more into that. Any other concern? Okay, thank you. So we proceed. IBS is now the topic. So in IBS is a group of disorders. IBS is a group of disorders. To be specific too, that is ulcerative colitis. I believe most of us know ulcerative colitis. Ulcerative colitis and Crohn's disease. We'll see them in the coming slides. Actually, today I intended that we should cover ulcerative colitis and Crohn's disease only, but I didn't. I didn't make slides for that, but we'll cover them deeply because I've met a lot of patients with IBS. When you go to the hospital and you are diagnosed with either of the two, your diagnosis will read IBS. They won't tell you which specific one, but the good doctors will tell you the specific irritable bowel syndrome you're suffering from. So there's a difference between the two. There's a difference between the two. So IBS, so the irritable bowel syndrome, it normally causes symptoms like stomach cramps, bloating, diarrhea, constipation, and IBS normally is idiopathic. To mean the cause normally is not known, but both of them, that is Crohn's and ulcerative colitis, they are ulcers, they are wounds in your colon, and in the ileum, and so their cause normally is not known. Those are some of the symptoms: constipation, pain, alternating constipation and diarrhea. This is the major way, actually the best way to know it. Alternative constipation and diarrhea. Sometimes it might come with, there is a patient that I had, he was complaining consistently about back pain and stomach pain. And most patients who have IBS, they should not be fed, they should not eat raw vegetables, they should not eat salads, because it will worsen the and painless diarrhea with mucus. It comes with mucus. So at times IBS can lead to loss of weight and all that. So what are some of the management? How can you manage IBS, these two symptoms together? So you should do some regular outdoor. If you want success, stay totally away from cigarette smoking. Do not use medicinal or street drugs if you want improvement. Mostly the cause of IBS is not known. Yeah, but being an ulcer, it's very, very easy to treat. Within 2 months. You become okay. So when your intestines upset you, temporarily go on a bland diet. Put vegetables and non-acid fruits through a blender. These are not my slides. That's why I'm reading them quite slowly. These are slides that were used by one of the trainers in the cohort that just ended, cohort 1. So mixing fruits and vegetables normally it's not a wise decision when it comes to stomach health, because they can lead to acidity in the stomach, and they can easily corrode the mucus lining. But when blended, there is at least some leeway, there is at least some safety. But it is wise to totally just let it alone, leave it. When blended, there are a lot of people who agree, because what normally makes vegetables, the main reason why you should not take vegetables and fruits is because of the cellulose, the cell wall. And mostly cellulose is the cell wall. It's very hard and indigestible. It's a fiber. Cellulose is a fiber. So mostly vegetables have a lot of cellulose. So when you take vegetables and fruits, the fruits will be digested very, very fast, and the vegetables will be just let to lie in the stomach, which will lead to their fermentation and all that. And actually, there are certain fruits that need specific enzymes to be stimulated for their digestion. And so it's normally wise to eat fruits and vegetables separately, even if it's blended. And when you have IBS, do not take raw vegetables. From my experience with such patients, do not give anyone who has those two diseases raw vegetables. So just be sure that you take a lot of fiber diet. And the best medicine that you can use, the best remedies that you can use for IBS is golden seal, slippery elm, and maya. They normally have a wonderful effect in maintaining the integrity of the mucus lining of the GIT system. To be specific, slippery elm is it's normally better than them. If you have a patient with any gastrointestinal disorder, if you give them a mixture of those particular 3 medications, you'll help them a lot, alongside the dietary recommendations that we've been talking about. So golden seal, slippery elm, and maya. Let me just type them so that you see. Today I didn't prepare slides. So you can mix equal parts of maya. That's the first tab. I've sent the herbs in our chat box. You can try accessing the chat box. You can mix equal parts of maya and golden seal. By equal parts, what I simply mean, if you are to take 2 tablespoons of golden seal, you'll take 2 tablespoons of maya as well. And then for slippery elm, you can put it twice the amount you have for maya and golden seal. So golden seal, if you have 1 part, you should have 1 part maya and 2 part slippery elm. That would mean if maya is 1 tablespoon, golden seal will be 1 tablespoon, slippery elm will be 2 tablespoons. So you can use that for your gut problems. And so if you find extracts and you mix them 1 part, 2 part, just dilute 2 tablespoons in a glass of warm water and drink. That's if they're extracts. But if it's local, boil 3 tablespoons in 1 liter of warm water. 1 liter of warm water for 10 minutes. If you're boil for 10 minutes. After the 10 minutes, you can put off your fire, then wait for it to be warm, and then drink that particular liter twice a day. And you should do that for about 3 weeks. And for those 2 diseases, we'll see the difference between the two. Enemas would really work well for mostly those who are complaining of back pain. So Crohn's disease, this is one of the irritatory bowel disease. This is one of them, Crohn's. So it's one of the diseases under inflammatory bowel disease. So Crohn's disease, mostly it affects the terminal end of the ileum, the end, the part that gets or borders the colon, and now the ileum is getting into the colon. It normally affects that particular part. And where the sections where corns are affected, it normally becomes, those portions, they normally become very, very hard and constricted. You can describe it as a horse shape. It normally becomes very hard and constricted. So it's normally what is the simplest way of putting this? What's the simplest way of putting this? Okay. So let's just read through the slides before probably I put it in a simplest way. So management, that is for Crohn's, or the treatment plan and courses are just the same as ulcers. As I said, Crohn's disease and ulcerative colitis, they're just ulcers or wounds in your ileum and the duodenum. Not really duodenum, but the colon. The colon. These are ulcers in your colon and your duodenum. The cause is normally not known. So the difference between there are several differences actually, but the main difference, okay, well, one of the differences you see, or the ulcerative colitis, it normally affects the first two, the first two walls of your intestine, and then Crohn's, it normally affects all the four walls of the intestine. And the nature is also different. For for Crohn's, it normally affects. It starts from the terminal end of the ileum, and it can also be elsewhere in the ileum, but it starts in the terminal end and it's not continuous. For ulcerative colitis, it normally starts in the terminal end of your colon and it's continuous. It's continuous. So you just treat it the same way you treat ulcers, this particular one, but ensure you don't give such patients raw vegetables. I'll insist on that. But we'll see further how we can diagnose by abdominal examination these two diseases in practical classes. So halitosis is bad breath. Halitosis is bad breath, and we said constipation, bad breath is just a symptom, or it's a sign of poor or unhealthy gut. It's a sign of an unhealthy gut. I'll send to us some stories so that we can read and go through it in our group today. It's a very interesting and catchy story. Very interesting and catchy. I'll send it to us today. Yeah, I believe it's in 3 parts. So I'll send part 1 and 2 tonight. So halitosis is bad breath, and it's normally indicative of poor colon health, and that is constipation alongside other. So there is something called toxemia. Toxemia is, should I call it dirty blood? Allow me just to call toxemia dirty blood. Yeah, dirty blood. Yeah, so when you're constipated, it's very easy for some of the components that should not get into that should not be absorbed. It's very easy for them to be absorbed into the blood, and at times you can feel it through your breath. So one of the causes of halitosis or bad breath is the one that most people normally know, is like if you have a bad breath, the very first your instincts will first tell you to probably go and brush your teeth. So when you don't regularly and carefully brush your teeth, it can cause halitosis or bad breath. But at times you can be brushing your teeth regularly, very faithful in brushing your teeth, but you still have bad breath at times. At times it happens. Why? Because your digestive health has been compromised, and there is a lot of acid. Not really acid, the blood cannot be acid. If it becomes acid, you die. There's a lot of particles in your blood that should not get there. There's a lot of build-up of dirty particles in your blood. So when you have halitosis, just brush, drink more water so that you can dehydrate your system. Eat raw foods that will help to cleanse your gut. Take garlic. There is odorless garlic. There's odorless garlic. There's garlic if you take there's garlic that you can take and your mouth won't really smell that bad. But you can there are things that you can easily use to do away with that smell of garlic. I know of parsley. I know of grape seed. You can always chew some grape seeds after using garlic. You can always use some parsley. Tea after using garlic, it will do away with that breath. So garlic will really help to kill the bacteria that are causing that particular bad health. Because when there's a lot of bacteria in your colon or in your ileum, they normally lead to build up of gas that at times can come out through belching or the bad breath. Aloe vera should also be included here. And so when brushing, I believe you know what the best things to use to brush. Anything that has fluoride in it, at times it's not normally that healthy. So that's just the simplest treatment for halitosis. Just ensure your bowel movement is regular. Your bowel movement is regular. That's number one. Ensure that your bowel movement is regular. Number two, in the treatment of halitosis, take something that will help maintain the integrity of the digestive system. What do I mean by maintaining the integrity of the digestive system? What I mean is this. There is a balance between good and bad bacteria in your system. And so avoid anything that we mentioned earlier anything that will affect negatively that particular balance, the gut flora. We talked about highly refined foods, fried foods. We talked about caffeine and its byproducts. We talked about sugar, anything that will affect the integrity of the digestive system. And then secondly, you'll need to take some herbs that will help to cleanse the blood. I normally like referring to them as blood tonics. We'll know and see what blood tonics are. You can take herbs that can cleanse the blood. They're called blood tonics. And one of these herbs is burdock. Burdock is a very good blood tonic. We also have, there's this one that Ellen White used to, she used it a lot. I'm forgetting its name. Used it a lot. I'm forgetting the name. We have burdock and what? It's normally very good for cancers. I'm forgetting, but hopefully along as we continue, I'll be able to remember. So we've talked about this belching. Belching, that is, I believe we know what belching is. The gas that is built up in your stomach can be removed through the mouth. So some of the things that you need to do is do away with the causes. We've talked about carbonated drinks. We've talked about cooking. You should not overcook your foods. There are foods that should be cooked very sensitively, like beans, so that they do not cause a lot of gas. Number one, the best way of cooking beans probably is to first soak them, or you can cook them under low heat for some time. It will help do away with the gas. And do not drink out of cans, bottles, or through straws. Anything that would interfere with the gut flora will cause belching. It will cause bloating in your stomach. So just get back to Eden, take your foods as simplest as possible. Highly refined products, let them alone. So for belching, just increase water intake and leave alone these particular things that we've mentioned. Just diet alone, you'll be okay. Bloating or glass or like flatulence or gas, you can use fenugreek. This particular one. If you know someone who has a constantly bloated stomach, fenugreek is the best. So you can mix one tablespoon of fenugreek and 1 tablespoon of fennel seeds. Boil them for 10 minutes in a glass of water. Give them to drink. Do that 3 times a day for 1 week. And ensure that you don't take simple sugars, any fermented foods, and you'll just be good to go. Highly refined products and fried foods, you'll be good to go. And ensure that you do not mix fruits and vegetables. There are fruits that should not be mixed with some fruits, of which I believe we saw earlier in our first class. So I see Valentine has raised her hand. Probably I'll give her an opportunity to raise her concern. Go ahead, Valentine.
I just wanted you to repeat you've said the tablespoon of fennel and fenugreek powder. I missed that.
Yes.
Kindly, yes.
Kindly.
I missed that. I only had a tablespoon of fennel and fenugreek powder. Past that, I missed that.
Okay. So I'll repeat, and also as well I'm typing it in the chat box. So fennel 1 tablespoon, fenugreek 1 tablespoon. Boil them in 500 ml water. 500 ml water. After boiling for 10 minutes. So you put them after the water has started boiling, then you let them boil for 10 minutes. So you just put them after the water has started boiling. Boil for 10 minutes. And then wait for it to become warm. You wait for it to become warm, and then you'll sieve and drink. I've written it in the chat box. You can go ahead and confirm for bloating. Activated charcoal is good. Activated charcoal is also good for bloating, but we want to avoid using activated charcoal unless it's an emergency. That's why I'm giving as alternatives. So these are best and less harmful. Less harmful, yes. So we have fennel, blah blah blah, and all that. So the 500 ml, you should take it once in one sitting, and then make another one at noon, and then a third one in the evening. Yeah, for 1 week. Your hand is still raised, Valentine. And Asnet, your hand is also still raised. Okay, we'll continue. So we'll continue to heartburn. I'll make my own thoughts on these particular disorders that are we've discussed, and I'll share them to the group. We continue to heartburn. Heartburn acidosis, that is an acidic condition of acid in the stomach that relapse or refluxes to the stomach, and at times it can be at times you can mistake it with heart attack acid. So heartburn can mistake it with heart attack. So this is why we have GERD, or the gastrointestinal reflux disease. So it's normally its main symptom is a burning sensation in the epigastric region. The epigastric region is the middle upper region of your abdomen. You can confirm, or you can look at the picture that I sent in the group earlier. You'll see where the epigastric region is, the middle upper region of the stomach, just above the umbilical region. Below the umbilical region, we have the hypogastric region. So heartburn is a burning pain in your chest, just behind your breastbone. The pain is often worse after eating. It's often worse after eating. And don't mistake this with ulcers, because for gastric ulcers, it normally gets worse after eating. It normally gets worse after eating. For duodenal ulcers, it normally gets well after eating. It comes down after eating. So don't mistake this heartburn with gastric ulcers. In the evening, or when lying down on bed, bending over. So this is just simply the reflux of acid, which ends up burning the walls of the food pipe. The food pipe here is esophagus. The esophagus, which is, I believe, about how many meters long? Okay, I'm forgetting. 2 or 1. Really not sure. But that is heartburn. So for heartburn, there are some rules that you really need to look into. There are some dietary recommendations that you really need to look into. An example is mixing fruits and vegetables, mixing fruits that should not be mixed with other fruits. Another example is snacking that will cause heartburn. Snacking and drinking with your meals, eating as you drink. You should drink water, to be specific. For fruit juices, you can always drink them with your meals. So to be specific, when I talk about drinking with your meals, what I mean is water. So you should not drink water with your meals. You should drink water 30 or 15 minutes before your meals. It depends with the amount of water. And then 1 to 2 hours after the meals. So if you do those general rules, then these particular recommendations that I'll give will help you manage your heartburn. Activated charcoal is very, very good for heartburn. We have raw potato juice, which is very, very good for heartburn. And with the raw potato juice alone, you can do away with heartburn. So for the raw potato juice, you can use your juicer to make half a glass, not really half a glass, but half a cup. Half a cup is about 125 ml. So you can make raw potato juice, including its peel, its peels, and drink. It should be drunk immediately, because potatoes normally oxidizes. It normally oxidizes very, very quick. So immediately you make it, you should drink. So you should do that 3 times in a day for a period of 3 to 5 days. So that's one of the ways you can make the raw potato juice. Just don't peel unpeeled potato juiced in your juicer, or you can soak the raw potatoes. You can soak at least three to four medium-sized potatoes. Just cut them well. You can soak them in warm, not really warm, but cold water overnight. Soak them in cold water overnight. Put them in some dark and cool place in your kitchen, in a cabinet or something of that sort. Overnight. In the morning, drink that 500 ml twice, in the morning and in the afternoon. In the morning and in the afternoon. That will help with time to do away with your heartburn. So those are the two ways you can prepare raw potato juice. Raw potato juice is just okay and enough to do away with your heartburn. But you can as well use the other remedy that I talked about, slippery elm, golden seal, and maya. It will as well help. These are the ones I've talked about: greasy, fried, fatty foods, avoid meat and dairy products, caffeine. These are things that we've mentioned. And there are certain drugs that can as well cause heartburn. These ones we mentioned when talking about constipation. Talking about constipation and ulcers, we mentioned these drugs. So I believe that is still clear to us. Tobacco could as well cause all that. So up to that point, is there any question? Is there any question? I want us to end our class there. We've used 1 hour exactly. I've spent 1 hour exactly. Is there any question? There's a lot that we still need to cover. That we'll cover. So our next class is on Sunday. Today I don't want to suffer us long. Our next class is on Sunday. On Fridays we don't have classes, and Saturdays we don't have classes. But probably to cover all that we need to cover in the shortest period, we might have classes on Saturday night. I'll just send it to our group so that we can all vote on it if it will be possible. So if there is no question, I'll invite one of us to say a prayer so that we can close. So next.
Let us pray. Mighty Father in heaven, we come before thy throne of mercy this night. We thank you, King of glory, for caring for us. Thank you for this group that we are discussing on matters on how we are supposed to eat. Oh Father, help us so that our bodies can get well. We pray for those who have not joined this today, oh Father, that next time they join. We pray this in Jesus' name. Amen.
Amen, amen. And to those who are interested in joining cohort 3, you can just send me a message. Have a blessed night. Bye.
Denzel.
Bye.